Welcome to Sensual Vitality-TV.
Hi there, it's Dr. Andrea here, host of Sensual Vitality-TV and author of The Orgasm Prescription for Women. Like me, today's guest believes that just because you have a problem in your sex life doesn't mean that you're broken. Our aim is to provide a holistic approach to healing, which includes addressing psychologically induced pain, including vaginal pain. Now, I believe, like my guest does, that we need more professionals from various areas of expertise and different backgrounds to come together to share the evidence-based and empirical knowledge about sexuality and how to heal it on both an individual level and societal level. So, today's guest explains that much of the suffering encountered in her clinical work is a product of cultural shame and disconnect in the area of sexuality. She says that our modern culture often values rational thinking and the evidence from clinical studies over the innate human wisdom of feelings and intuitive knowing. Marthe Schneider is the co-founder of Tibetan Tantra Inc. and co-creator of Authentic Tantra, Holistic Sex Education, together with Davey Ward, who's also appeared on our show. Marthe has a background in dance, movement analysis, and physiotherapy. Her main interest has been in the areas of psychological health and women's health. In 2011, she designed and implemented the Physiotherapy in Women's Health course at Afad University for women in Omdurman, Sudan. In her clinical work, Marthe helps people who suffer from the consequences of various types of trauma, and in particular, traumas related to sexuality and genital pain conditions. Her motivation is to sow seeds of hope that healing is possible and to support her patients and students in reclaiming their ability to heal themselves. Marthe Schneider, thank you so much for joining us.
It's such a pleasure, Andrea. It really is. I'm excited that we can be here together and exchange and share with other people. It's so important and necessary.
It is important and necessary. And I really want to start off by digging into a bit of your background. As I mentioned, you have this background in dance and doing this physical therapy. So there's a lot of body stuff that informs what you do, in addition to Tantra and in addition to the really deep psychological healing. So I'd love to kind of get a sense of how your path has led you to where you are today.
Yeah, thank you for asking. It's been quite a journey. And for the longest time, I thought that my different areas of interest and experience were so scattered. And then after a while, I saw that they were perfectly aligned. Yeah, I started off studying dance. I studied belly dance and modern dance, contemporary dance. And then I went on to become a physiotherapist. And I always wanted to work with women for some reason. I always wanted to have this dream of going to the Middle East and help women, help women cope better by connecting to their power, to their artistic and creative expression. And so I was never an ordinary physiotherapist. So I did travel to Sudan, and I worked with women's health there and integrated movement into that, and ended up working in the field of sexual health as well, because women's health in Sudan is very much influenced by the fact that most women are circumcised and or have undergone what's more accurately called female genital mutilation. And so that took me into this big area of sexual pain. Yeah. And then I came back to Norway, and I continued practicing and wanted to expand my competency and become what is in Norway called a psychomotor physiotherapist, which basically means I work with the body and the psyche and the mind as one unit.
Okay. How long were you in the Sudan?
I was in the Sudan for 6 months.
Okay.
Yeah. not a very long time. Very intense.
But I could imagine that was probably very intense. Was that the first time that you had worked with women who had been, sexually, well, it's not really sexual trauma, but it's vaginal trauma, genital trauma?
Yeah. It was the first time I was in connection with one population that was so unified in that sort of pain.
Yeah.
I had patients before who had had pain, who had pain in the area of sexuality or their genitals, but I didn't have the tools to help them. So that's what I discovered when I came back from Sudan, and I took this other continued training and specialized in this holistic approach. I discovered that more and more people were coming to my office with pain in the area of sexuality, and I discovered that I didn't have the emotional availability for them, because I hadn't yet really healed my own relationship to my sexuality. So I decided to do something about that. So I started studying Tantra because I'd experienced that just talking about sexuality doesn't necessarily bring the body and the visceral memories and back into integration with the mind. So I chose to study Tantra and this specific method that integrates all these separated pieces. And through that, I was able to help people in this area. And it eventually grew into me now collaborating with gynecologists and psychologists and some urologists.
Yeah. But you told me that in your practice, it was almost like you could spot a woman who had had sexual trauma, even without her telling you. So what was it that you were picking up on, sort of subconsciously or unconsciously?
I would say that the first thing that comes to mind is the issue of communicating what you want and what you don't want, which to me has to do with boundaries. So I observed this almost questioning, do I have the right to be here?
Wow.
Kind of attitude. And also kind of being a little confused when asked, would you like to have me examine you with your clothes on or with your clothes off? As a physiotherapist, you always do a physical examination. And when I asked that question, whatever works for you, that's the answer they gave, or I don't know.
Wow.
And when there's this obvious body language telling you that the person is not completely present and safe and feeling comfortable, and you ask such a question and you get that kind of response, to me that was a little red flag. Yeah.
So how did you open up those kinds of conversations? Because the other thing that you told me was that many of these people were coming not necessarily with a diagnosis of, or they weren't necessarily seeking out problems totally related to sex. I mean, they were certainly coming in with pain, but how did you open up that dialogue so that women could feel safe and they could explore the types of treatment that you offer?
Mm-hmm. If they came to me, like in the beginning, I wasn't known to be this person who you could come
so now everyone just refers you the different cases.
It's different now.
There's a hint of sexual trauma. We know exactly where to send you.
Yeah. So before that happened, I used to be... if the woman didn't tell me right up front that she had sexual trauma, but I had that little feeling that I could sort of smell it, I would either ask as part of the outline, I have my many questions that I ask, and then I would just ask quite straight up front, have you ever been exposed to any type of sexual assault, or has anyone ever crossed boundaries with you and you have felt overwhelmed? But if I sensed that that kind of direct question isn't going to work, then I would be a little bit more subtle and just ask, has anyone ever crossed boundaries with you in a way that you didn't like? Mm-hmm. And then quite often I would get the answer, no. And then second or third or fourth time they came back to me, they would say, I've been thinking, and there's this experience, and I don't know if it kind of qualifies for what you call an overwhelming experience, and then they tell the story.
Wow.
So I've experienced that it's sometimes about sowing a seed and just showing that there is space for us to have that conversation, and then to allow people to come when they're ready.
And so you have gynecologists and urologists and other doctors that are sending clients to you who have pelvic pain or vaginal pain. So talk to me about some of the conditions that you're being referred, and then how your approach is to work with them, bringing in the psyche and the body and the physical therapy.
Right, absolutely. So the conditions that are commonly referred or used when patients are referred is things like vulvodynia or vestibulitis or dyspareunia, or I don't even know how to pronounce it in English.
Yeah, dyspareunia, that's how we say it.
Yeah.
So let's define those for our listeners.
Yeah. Absolutely. So these are different classifications of pain in the vagina or vulva area. Dyspareunia refers to pain during penetration. Vestibulitis refers to pain associated with really tight pelvic floor muscles. But my experience is that there are so many different variations of these conditions. So I tend to refer to them as pain issues in the vaginal and vulvar area, just because I don't want the diagnosis to limit my view on things.
Yeah, okay.
Yeah, so then in starting working with these patients, I always spend a good amount of time talking with them, letting them talk as much as possible so that I can get a feel of where they're coming from. I need to know their history very intimately in the area of sexuality and relationships. And also I need to figure out what are their beliefs about themselves and what sex should be and why the pain is there, and also their outlook on the future. And what I very often find is that they share a few things in common, these often young women, is that they believe they're broken. And that they will never make a relationship work because the sex thing is difficult. And a lot of them also believe that because of that, they're never going to be able to have a family if they don't already have kids. And they also believe that they're alone in having this condition. And that seems to be due to the fact that this isn't something we talk about a lot. A lot of healthcare workers don't even know how to diagnose this and how to see it as different from a urinary tract infection or a yeast infection. So a lot of these women have had numerous cures for these conditions and instead of getting to the right treatment at once. So then when we get a full scope of their beliefs, then I know that this is an area that we have to address. We can't just go to the physical and mechanical interventions and believe that that's enough. We have to address the emotional and spiritual side of things as well. Because believing that you're alone and broken is really this strong pain around disconnection from yourself and other people. You're separate, right?
Yeah. And I bet that just that conversation alone and hearing you express that you've seen it before, you've treated it before, that can give a woman so much hope that actually you might be able to get beyond this and not only have a relationship, but enjoy your sexual and intimate relationships. And yes, you can have a family.
Absolutely. That's so true. It's so true. Hope, as we know, is a very important factor in healing. It really makes a huge difference. It does. And these women also, they need to have their hope fully established so that they can actually take on the role of being their own healer, because there's only so much that I can do. I can be a guide, I can be a facilitator, but they really need to step into the driving seat and run their lives in areas where they haven't run their lives by themselves. I'm talking about how to advocate for themselves, how to go into landscapes and explore where they haven't wanted to explore before.
Mm-hmm. So talk me through some of the treatment modalities. So I hear what you're saying about being able to be an advocate and setting new boundaries. But I guess, if we had to start on probably their most obvious level is they want to get rid of the pain. So as a physiotherapist, how do you address that in your first, round of sessions? And then when do you let them know about the exciting work of Tantra and how deep the spiritual connection and the spiritual healing can go from that point?
Yeah. As long as I'm working under the umbrella of being a physiotherapist, I don't actually mention the word Tantra very often, unless there's someone who brings it up themselves. But I do mention the content of it, and I teach them the methods. So we can easily get caught up in semantics, and that can actually create boundaries sometimes. So since I'm working under this umbrella, I just have to be careful about the words I use, sadly. But anyways, what I have to do is I have to know what is the status of their PC muscles, their pelvic floor. So if the woman isn't in such a place and state that doing a vaginal examination is going to be re-traumatizing, then I will perform that examination using my fingers to feel the tension of the pelvic floor muscles. Now, if that is too much for the woman at this stage, then I will do as best as I can on the outside, feeling very close to the sits bone, and figure out whether this woman is able to both contract these muscles by voluntary will and relax them, or if this is completely out of her control. And very commonly, it is not something they can control. So then that is a very important place to start, to get them in full control over contraction and relaxation, as well as coordinating that with their breathing. So breathing is a very important part of the healing here. If breathing begins to become more shallow and maybe even held, that's a sign to me that something is now moving in the right direction here.
Mm-hmm. Because that's always going to contract our muscles. If we're not breathing, there's always going to be that sense of contraction. So let's talk a little bit more about the breath and how you're helping women, because as they're laying there on a massage table, I imagine that just with doing the breathing, they can start to create relaxation.
It's so powerful. It's so powerful. Before I do any vaginal examination, I always make sure that we can establish a good sense of relaxation and trust between the patient and me, and that is by working with the breath. So the breathing, on a very mechanical level, we need to have the expansion of the diaphragm down in order to provide a little bit of increased pressure to the pelvic floor so that it gives way. And then as we exhale, we can contract a little bit. That this just happens by itself. So that's the mechanical part of it in relationship to the pelvic floor. But also breathing into one's entire body, one's entire torso, also brings presence and connection to these areas of the body that are commonly holding on to stories that haven't been told. So just bringing that back into the equation allows for a lot of women to remember and to start telling these stories. So breathing and also hearing one's own voice sighing, like, it's a sigh of relief. And we do that quite spontaneously when we're coming back from a long trip and we're just dumping our bodies down into the couch and we just go, it's a sigh of relief and a sigh of pleasure. And when we hear that, we actually get this message to our nervous system that it's okay to relax now. You're safe enough to sigh of relief. So that just gets the whole system into a process of reestablishing calm and peace and being receptive to healing happening. Mm. So that's a very important starting point. And I always make sure that my patients take this home. I give them specific homework or home play to practice breathing in this specific way so that they can start to notice, just like I do when they're at my office, when they stop breathing. And I teach them about how those moments are important invitations from themselves to reconnect with something that's obviously a little bit too scary for them to connect to normally. So I make sure that they have some tools for how to deal with whatever is arising. So I can talk about that too, if you want to.
Yeah, I think we should, because it would seem that maybe you're also working or sending them to like a psychologist or a therapist to do some of the talk therapy if they've never shared their trauma before. So what other tools are you helping them with?
Yeah. So in my practice, I've learned to use some communication tools, like talk therapy tools, but I'm not a psychologist. So I do collaborate with psychologists, especially if the amount of trauma is very big and unprocessed, then we will definitely draw on more than just my resources. And I also make sure that the people I work with have some tools to use when they're on their own, because sometimes it's just like opening the door and there's this vast universe on the other side and it starts to seep through, and it's very important for them to have something to use if they're not, sitting in front of their psychologist when this happens. So I teach them about how reconnecting to themselves has to do with becoming aware of their emotions, and how their emotions are messengers about needs being met or not being met. So this is something I learned from studying NVC, nonviolent communication, by Marshall Rosenberg, which I've come to love as a tool to cultivate self-empathy, to reconnect or to establish an understanding and respect for the fact that everything we do has a reason. We're always attempting to meet our needs, and sometimes to the detriment of other needs, especially if we are in situations where we're feeling really disempowered. So for these women, it's really key to use methods like this one in order to get past the self-blame, the shame and the guilt, because they very often have guilt feelings towards themselves and can have a lot of anger also.
Yeah, and I find that when we don't process those emotions, I always say that, like you, that our emotions are messengers, and emotion is just energy in motion. And if we don't express it or process it, it can get locked in our bodies and locked in our cells and even the brain connections. So I think that's wonderful that you're helping them to learn how to release in a safe way so that they can process that energy and get it out.
Absolutely. And I really find that the pain condition is very much fueled by things that happen in the brain. So the beliefs. So that's why the belief system is so important for me to identify at the very start. Because if they have associations to the pain that, for example, say, oh, this pain signifies that I will never have a family, Nobody's going to love me because they can't put their penis inside of me without me having pain. So I will never have children. So if they have this long, train of thoughts connected to the pain, then the alarm clocks are going to ring so loudly in the brain and saying that this pain is so dangerous for you. So you better ramp it up because nothing's happening here. It's still happening. This pain is still here. So we have to turn up the dial so that the attention is drawn and there will be an intervention. But as long as they are feeling very ashamed about the issue and believing they're alone and that there's no cure, they're gonna not seek help. So it's very important to try to break that evil cycle that is making the pain become centralized in the brain and chronic.
Wow, that's a really, really great distinction. So I know that you have a practice that you lead us through about putting our hands on our heart and connecting. But before we get to that, have we missed anything else? Are there other elements of your approach that you want to highlight?
Yeah. I also give people the homework to use a pleasure journal to simply cultivate the opposite of the pain. Because very often when I ask them, what are you feeling in your body? They will report where they have pain or where they don't have pain. Not reporting, oh, this chair feels really lovely to sit in and my stomach feels nice and full and actually I'm a little thirsty. Things like that. Because there's always a lot going on in the body and in the mind and in the emotional landscape. So I teach them to bring the attention onto other areas of pleasure, sensual pleasure, taste, touch, smell, hearing, and sight, and also emotional pleasure. Are you feeling hopeful? Great. Put that in your journal. Think about that before you go to sleep. Much better than thinking about, the doom that's gonna, happen. So yeah, pleasure journal is key. And also, when they're ready to reclaim their sexuality by touching themselves in a loving way. So this can be, on different levels. But I do teach about what's the anatomy of your pleasure organs. How do they function? What do you need to do in order to bring out the best in terms of pleasure and juicy experiences, so that they can have that ownership and not be at the mercy of some amazing night lover coming, to them and giving them the kiss of life, as in the fairy tales.
Right.
Yeah.
Awesome. And so would you like to lead us through the practice, and then we can talk about the Tantra side, but I'd like to just maybe take a pause where we can help anyone who may have these feelings kind of getting bubbled up to the top as we're talking about some of the pain and the trauma.
Absolutely. So this is one of the practices that has to do with breathing, but also with meditation, because meditation is key here. So we're going to have one hand on the heart, or just covering the heart area, and one either on the very lower part of your abdomen, or if it's not too much for you, to just cover your vulva with the other hand. And then you're going to take a little bit of time just to put the tongue on the back of the teeth, so resting at the roof of the palate, and just maintain a very soft gaze and looking into the space in front of you. Just sensing what's underneath your palms as you inhale and exhale through the nose. And now we're going to count the breathing. So one inhalation and an exhalation counts as one breath. And we're going to count 10 breaths. Now, as you come close to the 10th exhalation, the 10th breath, you can just let go of the counting and just take a moment to feel into and notice what's going on inside of you. Any physical sensations, any thoughts, any feelings. And now, if we had our pleasure journals handy, you could just make a little note about what you notice. And then we're going to do a teeny bit of what I call ocean breathing. So you're going to open your mouth wide, enough to fit 2 fingers between your teeth. It's a quite big open mouth. And try to relax. Maybe you move your jaw like that. And then to just use the sigh of relief. Just keep going and do a few of those. Allowing all the tension in the body to disappear with the exhale. That's great. And as you keep going, inhale all the way into your genitals. Yawns are the best. So breathing into the genitals and relaxing on the exhale. Good. How do you feel?
Very relaxed.
Yeah.
I could feel, my neck and my shoulders and everything just sort of get centered and present.
That's good. That's exactly the kind of effect that this whole practice is for. Is to first bring the chatter, the chaos atmosphere in the mind, to bring it down, cool it down a little bit so we reach this other wavelength. Usually it takes a little bit more than 10th breath, but this is a little sneak peek. And then to arrive there and then to use that space to bring more relaxation into mind and body and presence into the whole pelvis. And be in connection with and respect anything that comes up. Yeah,
that's a beautiful mindfulness practice. Just starting to take note of what we feel and where the energy goes as we give ourselves permission to relax and to focus on ourselves and to just feel what we feel.
Exactly, and have tolerance for it.
Yeah.
Try to not be so judgmental about it. Try to just notice what the feeling is. And like you said, see it as a messenger. Respect it. Yeah.
Exactly.
Yeah. From this on, we can go into more about the Tantra, right?
Yeah, because I know that one of the things that most people hear when they first start, besides the orgasm that your partner in Tantra, Baby Ward, shared, but many people have heard about, gazing into your partner's eyes or synchronizing your breath with them so that you both become present, and either putting a hand on your partner's heart or on their genitals with the non-sexual thing. It's just really about that connecting the breath and the attention. So, I'd love to hear more about how you up there in Norway got connected to someone in the US, and now how you have partnered to create, Tibetan Tantra Inc. and you're helping to certify people. So it's both for people who want to learn how to use Tantra in their own lives, in their intimate relationships, but also helping people to teach. So much to discuss. I'll let you kick it off.
Okay. Yeah, I actually thought you wanted to talk about how I use the Tantra aspect in healing the pain conditions also, which I can, yes. Okay. So we'll see how much we have time for. Yeah, the modality that we have named Authentic Tantra is a modality for sexual healing using these ancient tantric practices from Tibet that have to do with a path towards enlightenment, ultimately. That is the reason why we have these teachings. Now, these teachings also include the sexual application. And we have gotten permission, and we're sanctioned by our Lama Tashi Danrap, to use the sexual application of these teachings for the purpose of this sexual healing modality. So it's taking these ancient old practices and weaving them in with the best we have from the Western or modern approaches towards how to heal trauma, how to bring mindfulness into the area of sexuality, and how to gain more deeper intimacy with oneself and one's partner. So the people who do this course, they are applying these methods to all kinds of areas. Couples therapy, they're applied to, people who are already established as coaches, maybe life coaches, or maybe they're working in the health sector as a healthcare professional, or maybe they work with massage therapy, and they can integrate the energetic work if they want to do that. Our emphasis is more on the coaching side, so that people learn how to empower other people by doing, using this platform that we're doing now. We're talking to each other through a screen, and I can give the other person tools to practice on themselves, and then guide and support them as to how to apply it when they come across obstacles, how to deal with the obstacles, and so forth.
So let's back up and then start from where we just came from, where you've got a woman that you maybe have worked with on many sessions, and now she is feeling more comfortable. She can share with you what she's experienced. She's done some of the home play, the mindfulness, the breathing exercises, and now maybe she's actually ready to look at her sensuality as a source of pleasure instead of just pain. How do you bring in the Tantra in that setting?
So one of the ways is to use a similar kind of introduction as we just did, the little practice we did, to introduce one of the tantric meditations that has to do with the element that resides in the sex chakra. In the Tibetan tradition, that's the element of fire. So for this person, I'm working with, I would teach her how to meditate on the element of fire, to activate it and to ignite, so to speak, the positive aspect of fire, which has to do with magnetizing as opposed to being attached and clinging on to.
Right.
Right there's a powerful shift.
I think when you think of fire, we think of it as a consuming flame.
Yes. Absolutely. And we can also have the sensation of pain as burning, right? Yeah. So when the element of fire isn't balanced, there is disease on some level, on the energetic level or the emotional, mental, or physical. So in this case, for the person to activate their fire energy is very much affecting the rest of their healing experience, because energy comes before physical. As at least Eastern trained practitioners know, and I know this is where you're coming from too, that the energy body is senior to the physical. So it creates a foundation for them to make the other methods work better.
And so what would a meditation on fire, on the fire element, what would we be thinking of, or how would we change our breathing?
Yeah, it's a very specific and precise instruction. I could go through that, but it would take us a while.
Okay.
So I would rather have people, connect with us and have it taught to them properly, because it's also a transmission. So when I teach this, when I teach this meditation, I include the person into my meditation and I do it with them. So they get a transmission of what I do. And then they take it on from there. But what I can say is that it is It is a meditation where we bring our consciousness into the area where fire resides in the body, and we harness the energy that we can cultivate through the power of the mind and use it to heal the entire energy body. Mm-hmm. And it is also about, because Tantra is always motivated to healing self and benefiting self and others, always with this altruistic compassion. If it's not including that, it isn't Tantra.
Right.
That's a very important element. And so that right there is good medicine to heal the idea that these women are separated from other beings. Mm. They are alone in their pain. They somehow, this pain is a punishment for something. That's very often an idea that they must have done something bad. So just bringing in that very clear intention that I'm doing this to benefit myself and other beings is good medicine to heal the idea of separation. They can have more reverence for how they are interconnected with everything else.
Yeah.
Yeah. And also I can say about these meditations that in Tantra, the word Tantra from Sanskrit literally means to weave light and sound with form. Now, light is color, the vibration of light itself. That's color. And sound is mantras, seed syllables that activate, that are actually ringing with the vibration of the element itself. So these are primordial tools from this ancient tradition. And when this is woven into form, that refers to the body. Yeah. So we're using this kind of technology. It's like using a username and a password and connecting into what's already there and harnessing it for the purpose of healing. Yeah.
And I could see how that would be so empowering for a woman to take back that right and that authority to manage her own energy. And as you've said, to really become her own healer.
Absolutely. And to have that establishment of this more activated energy before she then moves into the sexual tantric practices. Yeah. So I would always teach someone to do this non-sexually first. So they, because it's all about multitasking eventually. They're going to be meditation and having sex with themselves at the same time. So they need to learn this piece by piece. And then when they're ready, they can use their self-pleasure practice in such a way that empowers the element, because they're able to meditate while they're experiencing intense degrees of pleasure. Mm-hmm. Now, the road to there may be, very bumpy, and it might have a lot of things come up that needs to be told and released and processed. But then eventually there's this increasing pleasure that it's, in my experience as a practitioner and a therapist, is that this is the pain level they come with. And pain is almost like numbness. And then as they start to have a little bit of pain experience, the pain goes down. And the more pleasure they're able to feel, the more the pain moves down on the scale. It's really interesting to watch. It's almost like one claims the space of the other.
Yeah. And so you're helping them to consciously raise their sense of pleasure, both through the journaling and focusing on energy and then self-pleasuring. It's raising that. Yeah. Beautiful.
Yeah, on all levels. Yeah.
So in addition to the certification program, which I know is kicking off in the United States in November, and you guys do that twice a year, or is it?
It's a 10-month.
It's in person twice, and then there's some ongoing coaching in between your sessions, right?
Yeah, there's ongoing coaching for 10 months. And with a midterm retreat where we come together and get an experience for how the methods are practiced together, it doesn't involve, having sex with each other like many people think.
People think it's like this massive orgy. It's like, but I love how Davey Ward was like, no, I'm not having sex with my llama. It's Hilarious. I know.
Yeah, there are a lot of misconceptions about Tantra because it's a very sexy word. It's become very sexy, so people use it for marketing practices that aren't necessarily Tantra.
Right.
So yeah, we have this midterm retreats, and then we go off into our separate locations. By the way, we teach people in all over the world. It's not just in the US. This is where we have our base. We have our retreats there, but we teach people who are living in other locations too, other continents. And then we have ongoing training until the end of the year, or I would say November, where we have the final retreat where people come back to demonstrate what they have learned and to prove that they are actually ready to take this process of using the methods for healing over to working with other people. So first they have the first half of the training is for them to dive into their own process, learning to use the methods themselves. They just learn one by one and get really comfortable and familiar with all the methods and own them. So they establish this yogic practice for them to do for the rest of their lives. And then the second half is how to apply that to working with other people, how to teach it.
Mm-hmm. And so we'll put the link in the description, but online they can find information at authentictantra.com.
Yes, authentictantra.com, and click on education. It's there, the certification program.
And the other thing that I've enjoyed watching is you and Baby Ward with your Sex as Medicine on YouTube. Yeah. I see the links all over the place.
Well, I'm happy to hear you've enjoyed it.
Yeah. It's juicy and it's fun. It's like these little Tantra tidbits with a very light and fun and sometimes playful attitude. I love the chemistry of you two together.
Yeah, thank you for sharing that. It's really fun to make these little episodes. And, this is in response to questions that people ask us.
Yeah.
And we are loving the fact that we get this opportunity to share these pieces of information with anyone out there. And we're very much excited about the opportunity to share information that can help people become empowered by not necessarily having to make an investment. So that's why we made Sex as Medicine, because we're suffering as a culture. We're suffering from lack of education around sexuality and misconceptions about what it should be. Yeah. Yes. So that's what Sex as Medicine is for. Yeah.
Well, it's a lot of fun. So I'll put the link to your YouTube channel as well. But one of the other nice things that I've enjoyed watching is the pleasure guide. Why don't you tell us about that?
Right. So the female orgasm guide is a 5-step video guide that takes you as a listener, and I welcome both men and women, people who identify as male and females, to watch the female pleasure guide, because it really brings light into the area of why women aren't experiencing all their over 11 different kinds of orgasm. Mm-hmm. And what it takes to unleash that potential. So it's a little piece, it's quite extensive actually, piece of education about what commonly comes in the way, the 3 blocks to bliss, and then on the other side, the potential that we have for bliss and pleasure, and a little bit about how to reconnect and cultivate that potential. Because sex education is very much about, conventional sex education is very much about how to not become ill from an illness that you contract through sexual intercourse, and how to not become pregnant. Right. What about female pleasure? It's a huge taboo right there. So it's okay to a certain degree to talk about male pleasure, but not so much female pleasure.
As you know, I'm a huge advocate for helping women and their partners, male and female, really understand what blocks our pleasure, what blocks our voice, and being able to surrender and accept it. So watch the Female Pleasure Guide. It is an excellent piece of education and beautifully, beautifully done. Well, I just want to once again, just thank you and honor you for the work that you're doing for women in your country, in Norway, and as well as the women that are being able to respond and react and interact with you and baby through your online programs and the Sex is Medicine YouTube experience that is so fun and it's so engaging. So thank you for all that you're doing to help people really get the sex education that they need, and most importantly, to step into that experience of bliss and being able to just reconnect with what we talked about earlier, the hope and the optimism that something really juicy and delicious is possible, even if you've had trauma, even if you've had some sort of pelvic disorder. There is life beyond that. And then if you really want to go deep into this spiritual experience of your sexuality, then there are pathways. So thank you for that, Martha. This has been fun and insightful, as usual.
Thank you so much, Andrea, for inviting me and giving me the airtime. And I also want to thank you for publishing your amazing book, The Orgasm Prescription, The Orgasm Prescription. I'm just reading it right now and I'm enjoying it so much. And I'm just loving that our offerings to the world are going so well hand in hand. So I just want to say to all the listeners out there that get your copy of this book and read it, because it's an amazing, juicy little book with so much good content.
Well, it has been a labor of love, and it's been very fun to write. And so it's wonderful now to get people around the world who are experiencing the orgasm experience and seeing that, there's a lighthearted and fun way to explore your sensuality. So thank you for this. Well, I am sure that just like what happened when we interviewed your partner, Baby, we ended up with people sending in questions and saying they wanted more and more and more. So I hope that you will keep the door open for us to invite you back.
Of course, I would be delighted to be back, and I invite any sort of question. I'm always here to share more information when it's wanted.
Wonderful. All right, so you can check out AuthenticTantra.com to learn more about the teacher certification, to get a hold of your female pleasure guide for free, and all the other little juicy tidbits. So once again, Marthe Schneider, thank you for joining us for Sensual Vitality TV. And until next time, I would say, live orgasmically and thrive with Sensual Vitality. Bye.
Bye.
And to add a few more sexy ideas to your sexual repertoire, I invite you to explore your sexuality a bit more with the free Mindfulness 21 Days of Bliss program. The short daily rituals, meditations, and sexploration activities can open your mind and heart to a titillating new world of your vibrant, luscious sexuality. For more erotic, nerdy insights on how to improve your sex, love, or relationships, visit us online at sensualvitality.tv. Connect with us on Facebook at facebook.com/SVitalityTV.